everyone. Hi guys, Dr. Ashley DeBoer here from Rise Chiropractic. You want to introduce yourself?
Sure, and Dr. Krystyna Holland from Inclusive Care.
So we are going to, last week we kind of talked about just Dr. Krystyna in general. This week we're going to talk to you guys about postpartum care because we both work a lot with postpartum moms, but why it's so important for mommies of any amount of time postpartum. So it does not mean like 6 weeks, right? You could be 20 years postpartum. Why you might need pelvic floor PT work or PT work in general and chiropractic care too. So let's kind of start with maybe what are some of the, like, you don't have to be top 5 exactly, but kind of your top reasons why moms postpartum will seek you out. Sure. And then let's talk about why they may not seek you out, but they really should seek out a pelvic floor PT.
Sure.
Okay.
You want to go back and forth? So what I've seen, why people come to me, and then why people come to you. And
sure.
All right, cool.
Oh my God, you're gonna make me think. No, I'm just kidding. I'm just kidding.
So I typically see people postpartum, and they normally come because probably the number one reason people are like, oh, pelvic floor PT now is incontinence. So any type of leaking with laughing, jumping, coughing, sneezing, running. But people can also leak when they hear running water.
Yeah.
I've done seminars where people are like, I don't know if this is weird. Like, I don't think that this happens to anyone else. I'm like, that happens to a lot of people. So leaking when you hear running water.
Yeah.
Leaking when you pull your car in the garage and you go to put your key in the lock and you're like, oh, I got to go right now. And then you leak a little bit.
Right.
So
that you're like not being able to hold it until you need to.
Right.
Gotcha.
Yep.
So that's probably number one reason why they seek you out postpartumly. Probably number one reason for me postpartumly is some sort of pain. Yeah. So it's going to be back pain, but that also encompasses pubic pain. And then if they're a little bit more postpartum, it's more neck pain and back pain. Those are kind of the 2 big reasons why people will first seek me out. What's probably your next one?
Pain is actually probably my number 2, kind of the same. And it can be low back pain, it can be neck pain, sometimes just like persistent hip pain. They're like, my butt just really hurts all the time.
Makes total sense.
Yep. So pain
not
would
like
be
you
my
didn't
number 2.
like push something out of there.
Right, like all your bones didn't move. Like it's fine.
Right.
Yeah.
Right. I know. It's like I always say to my patients that I really I'll say dislike, not hate, okay? Dislike the whole 6-week OB appointment. You're good to go. No big deal. Not like you just pushed out an 8, 9, maybe 10-pound baby.
Yeah.
You know, and no rehab protocol, no really checkup protocol. It's just crazy to me because I'm like living in Colorado, right? It's like you take a step off the stair funny and slip on ice or something. They're like, oh yeah, let's send you to 6 weeks of physical therapy. You're like, you just kind of stretched your ankle a little bit. Come on.
Well, and like with a C-section, like I treat all sorts of musculoskeletal impairments, not just the pelvis, kind of a whole body, but what makes me a little bit different is my pelvic health education.
Right.
But if you got a knee, like any type of knee surgery, any type of ankle surgery, any type of wrist surgery, surely they would send you to physical therapy.
Oh, 100%.
But after a C-section, they're like, 6 weeks, okay, you're good to go, good luck.
Yeah, your scar looks okay. Yeah, I think we might have mentioned that in the last video too, of just the like, it just looks fine. They don't, no touching it, like they don't, any kind of guidance. So that's probably maybe that's not a reason they seek you out, but that should be a reason that they come seek you out,
they come
right?
see me,
when they had a C-section, period.
Yes, absolutely. Because what'll happen, right, is that'll scar down and it'll pull on the fascial layers and on the skin and on the muscles. Because that's not like a superficial surgery. They're opening up your abdominal cavity. So it's a big deal. I'm
4.5 years postpartum, had to have a C-section, and I still, even though I've done a lot of work on that area and stuff like that, I still have sometimes when I go to sneeze pain on the side. So that means there's still work to be done, and I've done work, and I'm 4.5 years postpartum. So I can only imagine women that have like not even thought about it.
Well, or like sensitivity on the scar. People will be like, oh, I can't wear high-waisted I can't wear a high-waisted bathing suit, or I can't wear tight-fitting clothes because it just really bothers my scar. Very treatable, and people just don't know.
Yeah, no, because you're not supposed to know. No, just kidding.
It's all just a secret.
Was there anything else that, because you gave us 2 reasons of why they might come to see you, was there...
Pain with sex would be the next one, is that a much smaller percentage of people know that that's an option, and that it doesn't, like, that they can have people are just, they have sex post baby, post delivery, and they're like, well, this is not what I thought it was going to be. This is different. And they'll go, and people ask their doctors, and their doctors will just say, like, well, you had a baby, what do you expect? Or they'll ask their moms, like, oh, you had a baby, what do you expect? What I expect for you is that you're going to have sex that's fun. And like that you'll be able to have an orgasm if you've previously been able to orgasm, and like that you'll be able to get back to doing the things you want to do, and like being able to connect with your partner. Right. Sex is how a lot of people become moms, and then all of a sudden it's like not a big deal anymore.
That's how you have a baby.
Right. So yeah.
Yeah. Well, yeah, because in our society, it's I guess I don't have many societies to compare it to, but definitely it's like you said, you kind of, you obviously have to have sex to have a baby, and then kind of postpartum, it's really all about baby. So even it, and especially if it's uncomfortable, then it's like, and then we wonder why relationships can be strained, right? For sure. So absolutely. Right? It's like you're already tired, you take the time to have sex, and then you hurt. You're not going to really want to have sex.
Well, and the worst thing you can do is, if you are having uncomfortable sex, is to just keep pushing through it. Like, do not have a glass of wine and get over it. Like, that's not a good medical plan. Seriously, I hear that all the time.
Yeah. I get it. They need a little liquid courage or pain reliever.
Yeah, it's not a good strategy. Don't do that. See someone, especially with pain with sex, see someone sooner rather than later, because your brain wants to protect you. And if you're having pain with intercourse, like something that should be pleasurable isn't, it's going to be really hard to get you back. It's harder to get you back to the having fun part.
Yeah. Yes. Yeah. So not to like take the subject away from sex or anything, but probably the second reason why most mommies seek me out postpartumly is just because they're feeling off. Mm-hmm. It's not necessarily pain. They're tired. Maybe their anxiety is a little bit heightened. I do see mommies a lot for that. And also they're just feeling really weak. So because of the stuff I do with BirthFit, just kind of getting a group of women together. I do one-on-one too, but mainly getting a group of women together, kind of building their tribe, getting back to movement. That's probably the second reason they seek me out for care and stuff like that.
Yeah, that's awesome.
Yeah.
That's really awesome.
One of the reasons, what was I going to say? Yeah, that's right. One of the reasons that I really think you need to seek out a pelvic floor PT postpartum also is if you had any kind of tearing. Mm-hmm. Because I definitely hear from moms, there's, the first birth, right, fine, whatever, it happened, they tore. The second or third, it can really lead to, if you've never done some sort of self-work as far as scar tissue, which most of us will not, or had somebody look at it, you have to remember that was stitched, so that creates scar tissue, and so the next time you have a baby, you can have issues dilating.
Absolutely. And
I have heard mommies say that they're in the middle of pushing, the OB midwife will say this area is not dilating, and literally physically break up the scar tissue at that time. And to me, I'm like, that sounds horrible, because it's not even done gentle. It before that, yeah. Right? I would imagine you would be much more gentle. Yes. So I would imagine maybe that's, but most mommies probably don't think about that either, just like the C-section, yeah?
Totally, yeah, absolutely. Yeah. And to your point, like, yes, if we have more time and more preparation, like, definitely my technique and strategy is a little bit different than, oh my gosh, we need this to dilate right now, baby's coming.
Right, so. Exactly. So what else? What else might make it like, that I should come see you?
Yeah, if you have any sorts of like heaviness in your pelvis or feel like your organs are falling out or bulging, either bulging, like a lot of times people will return to running and they'll stop running and they're like, oh, I just don't feel right down there. I feel like my pelvis is really heavy. I feel
like I still have baby's head
down
there, exactly. And baby's head's not down there.
Yeah. Exactly. Yeah. So that would be a time, pelvic organ prolapse is what that's often called, and that would be a really good time to come see me so that we can work on that. I'd love to see people before we get to that point in terms of returning to an exercise program that's going to be safe and set you up for your long-term goals.
Right.
Because again, if we rush everything because we got that go ahead at 6 weeks, what are we setting ourselves up for down the line? And is that going to support our long-term goals for our health and our bodies and our babies?
100%. That's really BirthFit's motto is like slow is fast. I know we all want to get to whatever this ideal postpartum body is. Some achieve it very, very quickly, maybe highly dysfunctional, and some never do, right? And so it's just to know that you can get to those goals, but maybe you need to take it a little easy at first, do some self-care, you know, to kind of get you ready so that you're not, whatever, 45 and running and peeing yourself.
Right.
You know, I guess that's kind of the most common thing that I hear, especially with exercises, the leakage and stuff like that.
Well, and I see a lot of like people who lift really heavy weights, like a lot of very active people who do CrossFit, for example. And normally first baby, I don't hear this, but second baby, I hear like, I wish I had known what I know now about postpartum recovery and even just exercising while pregnant during first baby. Yeah. Because they're finding that they're not having as good of outcomes, particularly after second baby, because there were circumstances that kind of set them up in such a way that they weren't as successful.
Right. And pelvic floor health is not all about Kegels.
No. Oh, no.
You know, so we've been taught this, right? And especially like alluding to like a high intensity workout or like a CrossFit workout, a lot of those ladies are way too tight. Yeah. You know, so they need the opposite. Right. You know, so that's why it's good to get an exam, which we'll talk to you hopefully next week about why you would need care prenatally and what that kind of looks like and everything like that. Yeah. But I mean, that's one of the reasons, like they don't realize it until maybe they struggled through the first birth and somebody or Google told them, hey, you might have a tight pelvic floor. Great. How do you relax a pelvic floor? Right. You know, like, okay, I'm relaxing my pelvic floor. You know, like, so having that guidance and everything is you know, imperative postpartumly too. But I think we said in the last video too, ideally, if somebody wants to start care postpartumly, like whether they're having some sort of symptom or just proactively, how many weeks? 3 weeks.
So so American College of Obstetrics and Gynecologists came out with their their fourth trimester recommendations, and so they want you to get in to see a medical provider at 3 weeks. Okay. And I'm a really good person to come see for that because we can look at. I won't go do an internal exam at 3 weeks. I'll start that at 6 weeks to really assess, especially if you've had any tearing and your scars and like your incisions still healing and stuff. But we can look at kind of what your core function is, particularly in terms of if you're concerned about diastasis recti, that's a good time to start looking at that. Yeah. Kind of start the mind-body connection, getting that back, kind of resetting.
Yeah, the dysfunction. I know that.
Resetting the system.
Yeah, so okay. 3 weeks. 3 weeks going to be, you know, sit down, kind of do an exam to kind of see where you're at. Yeah. If internal work is warranted, we'll 6 weeks or so. Yeah. Gotcha. Chiropractic care, a little bit different.
We need
right?
people.
Yeah. So so my patients that come to me prenatally, I do home visits. Yay! Yeah, so your first 2 weeks I come to you, so you don't have to lug baby out and really just spend that time at home. But I am out to your house within a week of giving birth.
That's awesome.
So, like I talked about in the last video, my adjusting style is super gentle with a instrument, so it's really easy to adjust you wherever I need to adjust you. So I always come to the house the first 2 weeks, and then I will check baby if baby needs to be checked too. That's a whole nother video some other time. Yeah. And then we pretty much stay on a weekly course for a while. I'm like you though, as far as like a rehab protocol, or we'll call it rehab protocol, or the birth fit work that I do with the group classes. I recommend mommies being at minimum 4 weeks postpartum, and that is only like, I got to hear about your birth. Yeah. Most time it's more like 6 weeks is when we're starting and stuff like that. But it starts super slow, you know, breathing and stuff like that too. Yeah. But if for whatever reason you take my birth fit course and you do not see Dr. Krystyna first, you will hear me say you need to go see Dr. Krystyna or another, if you have another pelvic floor PT you love, that's cool too. Just like I have many chiropractors that send their patients over.
Just see somebody. See somebody who specializes in it, who loves what they do, who's going to help you, like, give you the information that you need to set you up for success, like, during pregnancy, postpartum, and beyond.
Right. Okay, so my takeaways from what Dr. Krystyna told you about pelvic floor health are, if you're having any kind of pain, not just down there, but we'll leave that for this video. Yeah. Down there, during sex, not during sex, if you're leaking, if you've had a C-section, if you've had any kind of tearing, that you definitely, or heaviness in the pelvis, definitely need to have a consultation at very least, and then kind of go from there. For me, definitely, if you want chiropractic care, if you're interested in chiropractic care postpartumly, if you're having again, any kind of pain, low back pain, neck pain. A lot of mommies get neck pain, which you'll probably know is from their posture with nursing.
Right.
Is really the big thing. So nursing, bottle feeding, whatever, just this posture.
Mm-hmm.
So definitely any kind of pain, any kind of anxiety, or just this like sense of I cannot relax in your body is a great reason to seek out care. And then obviously just getting that pelvis, kind of like what you're working on too, right?
Yeah.
Getting that pelvis back into proper alignment so you feel good, but also whatever your family plan is, even if you're not planning on baby number 2 or 3 or wherever you're at,
Yeah.
you know, just that everything's back in proper alignment so that your core functions properly.
Right.
You don't have low back pain and sciatica your whole life because your core is misbalanced and you're breathing properly, right? I feel like there was something else I was going to say, but that's okay. Oh, that's right. That is why chiropractic and pelvic floor physical therapy and physical therapy in general really complement each other.
Absolutely. Yeah.
I know I've met other PTs, not because of the population I treat. Pelvic floor PT is just a really easy, like, you need to check this because I know they need it checked.
Well, yeah, you know so much more about that than a lot of other providers and people in general. So it's something it's already on your radar.
Yeah, and so I've met other PTs in the past where it's like almost like competitive, right? You know? So it's like, well, yeah, I do rehab. I don't do rehab like a pelvic floor PT. I can't do internal work, but a PT in general, I don't do that.
Yeah, we just look at different things.
Right, exactly. So they really, really work well together. So if I am encouraging you, or Dr. Krystyna is encouraging you to visit the other, there's a reason that we're telling you to go visit them, you know? All right. Well, was there anything else?
No, I think that's great.
Yeah, I think that's great too. All right, you guys. We'll talk to you guys next week. Any questions, you can always leave them in the comments. We'll share this on Dr. Krystyna's page so you can see it there too, so you can ask her questions directly. And I will put up the link to her Facebook page in the comments and also on the main Facebook page so y'all can like her page too. Yeah, huh? All right, you guys. We'll see you next week.
Happy Wednesday.
Yes, happy Wednesday. Bye.